Hey guys, this is Marcus with All American Health. We are a non-emergency medical transportation company. We also provide digital marketing solutions to home healthcare facilities, nursing facilities, healthcare plans, and all things non-emergency medical transportation. You can also reach out to us. We provide consulting services for NEMT businesses and also, great marketing consulting and outreach. Today, I want to talk with you guys about, I forgot, pitching your business. So a lot of your small companies, a lot of small NEMT companies, what someone would call a mom and pop, a lot of times you're in the vehicle driving, providing services. And if you're, contracted with a broker, they're going to keep you busy. They're going to keep you busy as soon as, they can, and they're going to go as late as they can. So, you're up 4:30 in the morning preparing to transport clients, either you or your staff. And if you have staff, you're probably keeping up with your staff, making sure they're doing what they're supposed to do. So a lot of you don't think you have time to pitch your services to facilities, to businesses. You have to make time, and you can't shy away from pitching. Even if a company doesn't take your services, you never know how it's going to come back around to you. It's about planting seeds, okay? And there's a time to plant seeds, and then there's a time to harvest the seeds that you planted. So you got to constantly plant seeds. You got to constantly pitch. I pitched for a health plan a couple of weeks ago, and the health plan actually didn't call me back. Okay, thank you. All right, cool. We'll be in touch. 2 days ago, a member from that health plan reached out to my company, and they were looking for a service that was a bit extreme. It danced on the line of non-emergency versus EMS. So I suggested that they actually call their health plan, and I didn't know this was the particular health insurance company, but I told them that they should look on the back of their card, the customer service line, call their health plan and see if the health plan actually covers the service. They did that, and the health plan reached out to us and said, what is it going to take for your company to be able to provide services? And it popped in my head. I was like, yeah, we just pitched for them, and we never received a call back. So we were able to work it out and provide the service. But I use that as an opportunity to follow up with that particular health plan and let them know, hey, we're already providing services to some of your clients. Reach out to your client, see how we did. And hopefully if we did a good job, maybe you guys can give us some more calls or refer your clients to us going forward. But that was just a situation where initially you don't think anything comes of it, but now it rolls back around as a great opportunity to get in front of that health plan again and see if you can continue to provide services to some of their clients that are in their network that are in need of services. One thing I know in the state of Florida, I can't speak for other states per se. I can. We consult. Well, we have clients in other states, but my focus is brokers in terms of the state of Florida. And what I found is the way the state of Florida is ran, a lot of other states are run similar. But my experience directly is in the state of Florida. Brokers have a lot of companies. There's always a need, and there's always someone being left. So health plans are constantly jumping from broker to broker to broker because you can't keep up with the growing population, especially here in the state of Florida. We've experienced a population boom that is unprecedented in the history of the state of Florida. And people are moving here, 4 or 5 times more than they were a decade ago, just a decade ago. And a lot of those individuals are moving from up north, coming down south. Once you come down south, you usually never go back up north. And so these individuals are constantly looking for providers. That's where you should be filling your gap with the services, because even the brokers can't keep up with the demand. It's just not enough providers and not enough vehicles. In this age of COVID, a large part of the workforce is going somewhere else and doing something else. You got a part of the workforce saying, forget all this transporting elderly, sick individuals who are directly affected by this pandemic. I'm going to learn the code, sit at home and fill out some information on a computer and figure that out. So they're not even, in the industry anymore. It's a lot of companies that went out of business and due to what happened in 2020. And they never recovered. Where a lot of people and a lot of companies are just feeling the effects of what happened in 2020 now, because they can't keep enough drivers on the road. So they can't keep generating income, yet they have these vehicles sitting here that are just, collecting dust and sitting on the sideline and still having to pay insurance for them. They're still having to make payments for them, car note payments and stuff, and they're not running. You got a couple providers who thought it was a smart idea to buy a $70,000 wheelchair van 2 years ago, and now they're coming to repo the vehicle. First of all, you shouldn't have bought that $70,000 car in the first place. What were you thinking? You can get up. Man, look, if you need help with your company, if you need help understanding how to pitch, how to put a presentation together so you can pitch, give us a call. Well, give me a call. I can walk you through that. We can actually create a template together that works with your company and that gets the message across. And we'll go through together how to build and scale your company, but also how to stay in front of health facilities, rehab centers, and hospitals so they know that you're there to provide your services. So just keep that in mind. Hopefully this has been helpful for you guys. You take care.